what is your plan for when there's reductions? Are you going to contract out, and then would you then put a limit on the amount that could be contracted out? Or the work is just going to go away, or what's going to happen?
I'm not sure that I totally agree that state government can somehow remain immune from the economic realities on the premise that somehow everything we do here is absolutely necessary. And I think that's a big part of what we'll debate about, what are our priorities. Secondly, this bill is all about funding our priorities and I'll say not overhead or not wasteful things. And so it very intentionally forces us to think about priorities and making sure that we are focused on the program side of it and the service to people. But maybe more directly to your question about human services, for example, so initiatives that are currently in discussion include putting up an automated eligibility and enrollment system. And if you looked at the number of people, not just in state government, but in county governments that manage just the intake function, eligibility, determination, and enrollment, it is a huge number of folks. And if we could put in some of the automated tools that are in place, Pennsylvania and Wisconsin, for example, just put in systems that are potentially available through public domain, we could actually serve people a lot better and achieve these kinds of targets. If we don't set these kind of targets, I question whether we'd really ever pursue those things. We're kind of locked into a workforce structure that might even preclude us from thinking about it. There's another idea from Lutheran Social Services about finding a way to aggregate all of the disability funding streams and do it in a consumer-directed, put those funds available to the disabled person and their caregivers through consumer-directed plans, almost a voucher-like model. And you think about the potential of that for reducing, kind of back office control mechanisms and all the program administration functions. So I think there's tons of great ideas all over the place, and none of them, kind of by definition, at least from what I've seen, absolutely necessitates somehow cutting benefits and cutting the very important things that we do.